This is Home Science for class 12th, and the chapter that is chosen today is chapter 3, Public Nutrition and Health. After going through this chapter, the children, the learners will be able to understand the following things as the objectives of the chapter. You will come to know about the significance of public nutrition, meaning and its importance. Then, nutritional problems of public health. After that, factors related to nutritional problems. Then, strategies to be used to tackle such problems that are related to nutrition as malnutrition. Then, the programs that are being operated to tackle the important nutritional problems. So, you must have noticed here in this chapter we are using the words public nutrition, public health, public problems of public, strategies related to tackle such problems related to the people, and the programs in operation or being implemented for the public health. So you see, this chapter is mainly related to the people as a whole, public, and not the individual. This is a special body of knowledge which is a combination of the nutritional, biological, behavioral, social, and managerial sciences. And here, the person who is involved in this is known as public nutritionist or community nutritionist. Community nutritionist. Okay. Now, what is community? Community is the specific group of people sharing common language, exposed to same environment, having similar conditions, same lifestyle, and common health problems. They're not necessarily living in a particular geographical area. They might be living at different places, but they have these things in common. So, to tackle their problems related to their health, that is related to the health nutrition for public, okay, or health related to the public. So, this is the field of study that is concerned with promotion of good health through prevention of nutrition related illness, sorry, problems in the population, and very important, the government policies and programs that are aimed at solving these problems. Okay, and such people who are public health nutritionists or professionals, they use large scale, organized, and multidisciplinary approaches to solve such problems that affect the population. All right. So, this is mainly related to the health of not an individual or wellness or dietary programs for one individual, but this is for the problems related to inappropriate nutritional conditions of the people as whole or in large group. Okay, so this is the meaning of public nutrition. Now, why it is required? It is required, especially in India, because of various problems caused or related to nutrition of the people. For example, we have PEM. What is PEM? This is an abbreviation which is protein energy malnutrition. Children, malnutrition is not the appropriate amount of the nutrients consumed by an individual or by the people as whole as their requirement. All right. So that is called malnutrition. It can be either overnutrition, sorry, or undernutrition. Over, when some nutrients are taken in excess, that is also not good. And when some nutrients are not consumed in right amount, they are lacking for long time, that is also not good. So then this occurs as protein energy malnutrition. This is a problem which is mainly seen in the society of low level or poor people, but it is not true 100%. This is seen in rich people also, and that is because of wrong food habits, bad food habits, or inappropriate consumption of the nutrients, or inadequate food intake, or insufficient intake of macronutrients. Macro means main nutrients like fats, proteins, carbohydrate, and this is mainly related to energy giving and body building nutrients, okay, like proteins. And children suffer more than the adults, and this is assessed by evaluating the anthropometric measurements, that is by calculating the weight, height, head, chest, circumference, etc. So this is one problem related to malnutrition, and that is protein energy malnutrition. Another is related to the micronutrients, deficiency of micronutrients. Micronutrients like vitamins and minerals, and the deficiency of such nutrients also causes lot of problems known as deficiency diseases. You know, the vitamins and minerals are also known as what? Preventive nutrients or protecting nutrients. Protecting, they are protecting our health and they are preventing the diseases. For example, when vitamin A is lacking, the problems related to eyes and eyesight, vision, they occur. Vitamin B, beriberi, C, scurvy, D related to bones, etc. So then we come to minerals like iodine, iron, calcium, phosphorus, etc. So when they are not taken in adequate amount in our diet, so many diseases are caused. For example, IDA. IDA is iron deficiency anemia. Iron deficiency anemia, that is more common among girls and pregnant women. Okay, and due to this, the level of hemoglobin production is reduced, and because of this, the person feels shortness of breath, or commonly known as breathlessness, okay, and fatigue and lethargic. Then another is VAD. What is VAD? VAD is vitamin A deficiency. All right. Vitamin A deficiency, as I have told you, is related to eyes and eyesight and vision. Then IDD. IDD is iodine deficiency disorder, and this is more common in the areas like Arunachal Pradesh, Jammu and Kashmir, Himalayan belt, okay, Andhra Pradesh, Karnataka, Kerala, Maharashtra, and Madhya Pradesh. So many states in our country, the people living in those states are having deficiency disorder of iodine. And because of this, what happens? Because of iodine, its inadequate consumption disturbs the functioning of thyroid, okay, hormone. And when it persists, goiter is caused. All right. Now, how to tackle these situations? Okay, at large level, or what the government has to do or does to tackle such problems at large level. Here, a policy known as NNP, that is National Nutrition Policy, that was formed by the government of India in 1993. Under this, an integrated program was launched known as ICDS, and the full form is Integrated Child Development Services. And this is mainly for children, adolescent girls, pregnant women, mothers, lactating mothers, all right, and boys and girls up to the age of 6 years. They were the target group. And what to do to such groups? To educate them, to provide them the help by providing these vitamins, iodine, etc., and to make them aware about the food rich in such macro and micronutrients. Macronutrients, proteins, carbohydrate, fats, and micronutrients, vitamins and minerals. All right. And what are the strategies, how they can be achieved? They are broadly classified as diet or food based strategies. Strategies are the ways. And second is nutrient based approach, or it is also known as medicinal approach. So, what is diet or food based strategies? This is related to the prevention of having such problems due to the consumption of the food, intake of food. Here, the people are told, they are educated, they are informed about the good food, about the way they are grown, okay, and about home gardening, nutrition, and health education, and food fortification, etc. Now we come to the strategy related to nutrient based or medicinal approach. This is related to providing like vitamin A, iron, and folic acid. And for this, supplementation programs, okay, are conducted, although they are quite expensive. Okay, and these are given to the vulnerable groups who are at risk of deficiency, okay, and those who are poor or unaware about the consequences of such things. Next topic is related to healthcare. What is healthcare? Healthcare is related to the human right, which is a right of human being to live a healthy life, to lead a healthy life, and to live in a healthy environment. And this is the responsibility of the government to provide such facilities like proper sanitation, supply of pure, safe drinking water, healthcare centers, okay, so at large level. And that is not merely related to just medical care, but it includes a multitude of services that help to promote maintain, monitor, and restore health. And that is provided at three levels: primary, secondary, and tertiary. At primary level, the family or community is targeted or is the focus. And such services are provided through a network of primary health centers at village level. Next is related to the health problems that are little more serious or complex. For them, second level is referred. Second level is related to the community health centers, okay, and district hospitals. And the problems that are more or most complex and serious problems, they are tackled under the strategy of third level, that is tertiary or highest level of healthcare. And such problems are tackled in the institutions like medical college hospitals, regional hospitals, specialized hospitals, and AIIMS, All India Institutes of Medical Sciences. Now we come to the scope of such education. What is this? Now, scope is related to the role of public nutritionist or community nutritionist, and the areas where they can serve are nutritional sciences, nutritional assessment. They can work in the following areas like outreach programs of hospitals for prevention and promotion and education related to public health care. Then, as a part of integrated child development services, then he can be as consultant advisor in policy making committees of the government. Then he can work in international organization like UNICEF, WHO, World Health Organization, all right, and can be a part of organizations that undertake large scale feeding programs for various target groups like young children, adolescents, pregnant women, lactating mothers, elderly people, or challenged individual who are physically challenged, and they can serve as school health counselors also. So this is about the objectives, meaning, deficiency of micronutrients, macronutrients, healthcare, and scope of public nutritionist or community nutritionist. Thank you.